Cancer sucks. I don't think you'll find anyone who disagrees with that. And it is also scary. There's been so many times I've had patients come in worried that what they're having or the symptoms they're having are due to cancer. It's scary, I get it, especially when you've seen it firsthand in someone you know or someone you love. In this video, I'm going to go over the cancer screening guidelines as suggested by the American Cancer Society. If you are interested in taking a deeper dive into this topic, I'll include a link to the American Cancer Society's website in the description below. Now, if you noticed, I was very specific about which organization wrote the guidelines, and that's because there are slight variations in the details depending on which organization issued them or published them. And the reason for the multiple guidelines with differing recommendations is probably a whole topic for another video altogether. Now, you may want to know, actually, I recommend that you sit down with your medical provider to discuss which guidelines are right for you to be following. Now, I will say I'm sorry for my trunk here again. I'm here waiting for pickup for my daughter. So I'm just taking the time to shoot a few minutes of video while I'm here. It's the parent's trunk. So the first cancer I'm going to be talking about is breast cancer. Breast cancer is the most commonly diagnosed cancer in the world today. The rates are highest in North America, Australia, New Zealand, and Western and Northern Europe. And they're lowest in Asia and Sub-Saharan Africa. Now, in developed countries with established screening programs, most breast cancer cases are detected during normal screening mammograms. All ages should be familiar with how their breasts look or feel. And if there are any changes, those are things to report to your doctor or medical provider. Starting at age 40 to 44, patients should have a choice to start screening if they choose to do so. And before doing so, of course, talk to your doctor about the pros and cons. Starting at age 45, screening mammograms are recommended annually. Then at age 55, you can switch to every 2 years, but if you choose to do so, you can continue annual screening if you'd like. Finally, for those age 65 and older, the recommendations are non-committal here. The American Cancer Society suggests or recommends getting mammograms every 2 years, but they also say that if you choose to do so annually, it's okay too. Now, one final point about breast cancer screening. Are breast exams even worth it? Now, I've heard some patients say that doctors don't do a physical exam anymore, that often all they do is get labs and imaging. So breast cancer screening is probably one category that does fall under this complaint, if you will. I remember being trained to do a clinical breast exam where you would palpate or feel the breast tissue for any lumps or abnormalities. There doesn't look like there's much benefit to doing clinical breast exam for screening purposes when a patient gets regular mammograms. The next type of cancer we typically screen for is cervical cancer. Now, in cervical cancer, it's recommended that people with the cervix should begin screening at age 25. There are a couple different types of tests, but if you're able to screen with a test that is HPV based, then you can do so every 5 years as long as the test is normal. Now, HPV is a virus that is associated with cervical cancer. Now, even if you've been vaccinated against HPV, it is recommended that you still screen at the regular interval. If your cervical cancer screening is done by a pap smear with HPV co-testing, this should be repeated every 3 years as long as things are normal. If there are any abnormalities with these tests, those abnormalities will dictate the next steps. For those with a history of a serious cervical precancer, screening should continue for 25 years after the diagnosis. If you've had your cervix removed for a reason unrelated to cervical cancer or precancer, then you don't need to continue screening afterwards. Finally, screening can end at age 65 if you've had normal tests in the prior 10 years. The next cancer is colon cancer. For colon cancer, screening should begin at age 45. Now, this is a change from the previous recommendation to start at age 50. So if you're watching this video, let your loved ones know to start screening at age 45. Now, to screen for colon cancer, there are several testing options. The gold standard is considered the colonoscopy. Assuming the large intestine is cleaned out appropriately or well, a normal colonoscopy means that you can repeat the test in 10 years. But if there are polyps or if there's abnormal findings, then the pathology or the type of polyp will determine when you should test again. Now, screening is recommended in general until the age of 75. People age 76 to 85 are in this gray area where they should talk to their healthcare provider about whether they should continue testing. And then, generally speaking, screening is no longer recommended after age 85. Lung cancer. For lung cancer, screening can begin at age 50, as long as the patient meets certain criteria. The criteria for screening for lung cancer are as follows. 1. Currently smoking or have quit smoking in the last 15 years. 2. Have no signs of lung cancer. And 3. There's a 20 pack year history of smoking. Now, pack years are calculated by multiplying the number of packs smoked per day by the number of years smoked. So, for example, if someone smoked 1 pack per day for 20 years, that's a 20 pack year history. 2 packs per day for 10 years is also a 20 pack year history. Now, it's important to note that for lung cancer screening, not all insurances cover this. So be sure to check with your insurance as well as your doctor if you fall into one of these categories. The last cancer I'm going to talk about is prostate cancer. Now, this is an area that has recently been in the news. This video I'm recording in 2023 in February. A month ago, there was a recent a recent article in the news that said that more men are being diagnosed with prostate cancer as PSA screening declines. And it goes into a history of how over the last 10 to 20 years, testing overall for prostate cancer has not been as emphasized. And so the numbers of screening, or the numbers screened, has been declining. But let me go over the recommendations first, and then I'll go over the articles afterwards. So the current recommendations as of right now is that starting at 45, men should discuss with their doctors whether or not to proceed with screening. And high-risk men can begin screening if they choose to do so, understanding, of course, the pros and cons to screening. Men with more than one close family member, and this is father, brother, or son, who had prostate cancer before the age of 65 should consider starting prostate cancer screening at age 40. Men with average risk for prostate cancer should discuss the risks and benefits of testing with their healthcare provider at the age of 50. They do make a comment that says age alone should not be a determining factor about testing for prostate cancer. And so men who continue to expect to live at least 10 more years should talk to their healthcare provider about whether they should continue testing. Last month, in January of 2023, a journal for the American Cancer Society published that deaths due to prostate cancer have increased and rose by nearly 3% from 2014 to 2019. This increase is reportedly driven by a diagnosis of advanced disease. Advanced disease means that the prostate cancer has spread to distant sites or has metastasized. So another way to refer to this is metastatic prostate cancer. Metastatic cancer is more difficult to treat, and there is no cure for metastatic prostate cancer. Now, one of the things that were considered or suggested was this might be linked to a decline in the widespread use of the PSA for testing. In the year 2008, the US PSTF, the United States Preventive Services Task Force, recommended against screening men aged 75 and older for prostate cancer. Their reasoning was that testing people or screening people older than 75 would lead to diagnoses of prostate cancer in patients where the prostate cancer would be so slow it wouldn't be the cause of death. Then in 2012, the USPSTF recommended against routine screening for all men. So the past decade or two has been full of this controversy between those who are advocating for screening with the PSA and those who are saying it shouldn't be done because there's no benefit to life extension. So the last decade and a half to 2 decades have been a big argument about whether we should or shouldn't screen for prostate cancer. Again, currently the recommendation is to have that personal discussion with your primary care provider or doctor and decide if it is right for you. It will be interesting to see if this recommendation changes in the near future with the publication of that article that I mentioned it was January 12, 2023. Now, it is important to note that the PSA itself is not considered a perfect test by any means. Its detractors have argued that PSA testing leads to a lot of unnecessary biopsies. Prostate cancer isn't the only reason for the PSA to be elevated. For example, prostate enlargement or inflammation can cause elevations in the PSA. Urinary tract infections can cause elevations in the PSA. And even urinary catheter placements can cause elevations. One thing I did find interesting, though, was that a couple of days ago there was an article published by The Independent, which is a UK news outlet, that there is a new test being developed over there for the detection of prostate cancer. And supposedly, when used with the PSA testing, it's 94% accurate in detecting prostate cancer. So it looks like there's a lot of work ahead, and this is cancer as a whole is a rapidly progressing field. Oncologists are constantly trying to stay up to date on what the latest regimens are and what's the best evidence for different types of cancers. So even though I'm uploading this video in 2023, who knows? By next year it could be way outdated. So hopefully this video has been helpful for you in breaking down the guidelines from the American Cancer Society on when to screen for the different types of cancers that we have screening for. Again, for your specific case or for your own healthcare, you should be talking to your doctor or healthcare provider about what tests you should be doing and at what age based on your risk factor profile. Thanks again for watching. Stay safe, stay healthy, and I'll see you in the next video.